Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Batteries Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. Today, I am joined by my guest, Dr. Francesco Di Chiara, a leading consultant thoracic surgeon at the John Radcliffe Hospital in Oxford and a true pioneer in minimally invasive chest surgery. Renowned internationally for developing and refining cutting-edge techniques, including groundbreaking single-incision procedure for thoracic outlet syndrome, Dr. Di Chiara is transforming the way we approach complex thoracic conditions with deep expertise in lung cancer, chest wall trauma, and rare disorders like thoracic endometriosis. He's not only a gifted surgeon, but also a passionate educator and an innovator. I am thrilled to be diving into this conversation with someone who is shaping the future for thoracic endometriosis. Please help me in welcoming Dr. Francesco Di Chiara. How rare or how common is thoracic endometriosis?
That's the bit I want to find out because I really don't believe it's rare. I think we're just seeing the tip of the iceberg. We are seeing the patient that not only managed to go 7, 8 years to be diagnosed endometriosis, but then also another several years to get to see a thoracic specialist that can be the diagnosis. So you're seeing a fraction of the fraction. For example, all my patients now come before through the gynecologist with already a diagnosis of endometriosis. I think the future will be I see adolescents that has at their first symptoms at the first, especially they see somebody for thoracic endometriosis. Now I'm seeing patients that are 30 plus and they already have diagnosis of endometriosis.
Is there risk in doing thoracic surgery for endometriosis on teens? And is there more risk of it coming back because they are so young?
Well, I mean, when it comes to excision, early surgery for the pelvis seems to have good results and increased quality of life. And although we don't have the numbers and the data to support this claim on thoracic endometriosis, it seems intuitive that the same logic you apply to the pelvis, you should apply to the chest. So actually, you should, improve the quality of life.
Is there more risk associated because they are so young with more adverse outcomes?
No, I would say actually it's safer because the main risk of thoracic surgery is related to aging, heart disease, and lung diseases, which are basically non-prevalent at all in teens and young adults. So it's generally considered safer operating younger individuals.
Have you seen a shift in the way that, and of course, this is going to be different from country to country because uh, with the US, insurance may or may not cover it if they see it on the heart. Are you noticing over in the UK that they're taking that more seriously in that healthcare system for those in the public health system to get better help?
So when it comes to provision of a complex endometriosis care in the UK, I think is a work in progress in the NHS, in the public health system. And we are debating as we speak with NHS England to create a network. But the provision is quite patchy across the country. There's not a definite unified program.
It's probably worldwide.
Yeah.
Yeah. It's tricky to get good surgeries covered, but does the severity dictate how it can be covered across the board? And I don't think that that's an easy answer for anyone to answer. So that's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in. and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.